Sitting here with some of the people from our behavioral health and infectious disease departments. And our entire purpose of shooting these videos is to demystify the HIV and HepC testing processes. And so we want to talk a little bit more and get into that today. So first of all, what are some of the, and anyone can take this, what are some of the misconceptions people have? Because without knowing that this is what testing looks like, you would think it maybe is a more involved process, right? And so what are some of the biggest misconceptions you guys run into as the people who are out there testing and doing this?
I think people are always surprised at how quick the results are. I mean, within a few minutes, we can tell whether you're testing positive for HIV or Hep C. And so that's a big one. It's also a sense of relief, especially if someone is worried that they might have either of those. Knowing in a few minutes rather than going into an office, getting blood drawn, having to wait a day or 2-3 days before their results, so that can cause a lot of stress.
Absolutely. And so these testing, you guys have you have testing events at least once a week. Mm-hmm. They're all the time. Mm-hmm. And so for anybody who sees that one of these events are happening, it's not a huge time thing. It doesn't take up a whole lot of time. It's not like you can literally come in on your lunch break, figure out what's going on. And not that it's that simple in regards to depending on, what the outcome is, but it doesn't have to be the wait, the draw, all the blood, and then go home and wait for results. That's a lot of stress. Yeah. And so what kind of, let's say someone does get a reactive test. Mm-hmm. What are their next steps?
So we always ask if they have a provider that they're seeing. Whether they do or not, they can still see us for treatment. Mm-hmm. And we have them fill out a new patient packet if they need one. And we get them in for additional blood work to confirm that the test was positive, the rapid test was correct in being positive. Mm-hmm. And then their provider goes over the best treatments for them. And we work on getting them that medication.
Mm-hmm. And then they also have access to behavioral health and counseling resources, because obviously if you get a positive test for one of these things, that can feel life-changing. That can feel very big. And so how quickly are they able to get behavioral health?
Yeah. As long as they're a patient of ours and they have that initial appointment with a medical provider, then they can see behavioral health. We'll get them in as soon as we can. And the reason why we do it that way is because we really want to focus on integrative care. And so if you are seeing one of our medical providers and then seeing a BH counselor or behavioral health counselor, we like to abbreviate it.
We love acronyms.
Yeah. Then you can get the best treatment possible. Our behavioral health provider can reference what's going on the medical side and vice versa. A lot of stress, anxiety, a lot of ailments really show up in the body. And so it's just the perfect balance to have everything incorporated.
Absolutely. And that is one of the absolute benefits of having true integrated behavioral health is that your behavioral health counselor and your provider have access to the same information. And then we also throw pharmacy on top of that, right? And so let's take a second and talk about what the medication, it's not, it might not be as big as it can feel to people, right? So let's say someone tests positive for hepatitis C. What could their medication regimen possibly look like?
So usually after we confirm that they have hepatitis C, we look at the viral load within the body. The provider decides the next best steps for treatment. And in certain scenarios, then we get them medication, either low cost or free. And then they take a medication for about 30 days. It's an antiviral medication, and it helps to control the virus load in the body. And so that way the hepatitis C doesn't continue to progress and worsen and wreak havoc within the body.
Okay. And then how is HIV, how would that look differently?
So with HIV, we still want to confirm through blood work. The provider will go over, best treatment options. And then there is a medication that the person takes every single day. and that prevents it from progressing into AIDS. And it also causes them to be undetectable, so that way they do not transmit it to someone else.
Sure. So those, I mean, they sound pretty similar, both of the processes there. And then let's talk about PrEP for just a second.
Yep.
Who wants to talk about PrEP? AJ can keep talking about PrEP.
I just love talking about this
Hey,
stuff.
that's okay. I love it. No, that's awesome.
Well, go ahead.
Well, we do talk about PrEP. There's a misconception that it's really just for one type of person.
Sure.
And it's not. It's for anybody who might be at risk of coming into contact with HIV, whether that is being sexually active, or using substances.
Sure. Needles especially, right? Yeah.
Yep, especially needles that aren't sterilized. I think that's probably what we see most often when someone is testing positive for hepatitis C, especially.
Yeah. Yeah. Okay. And so, so for PrEP, I think the misconception is typically that homosexual men, right? Like those are the people who need PrEP, and like that's not true, right? It is literally for anyone who just might be having sex, honestly.
Right. Regardless of your sexual orientation, regardless of who you are.
Yeah.
I mean, it's for anyone.
Right.
And
it protects you.
Yes.
Yes.
And it really is an amazing thing. We haven't always had this medication.
Right.
And so not only does it protect you, it protects everyone that you are with.
Yes. Yeah, absolutely. That's awesome. So like you guys are hitting it from all the angles, right? And we just want people to get tested because we cannot treat you and help you unless we know, right? Or unless you know. Like we're not even saying we have to be the ones who provide the care, but you cannot take care of yourself unless you know.
Yeah.
And so do we have anything else that we want to add to this? Any other pieces that you want people to know about the testing process?
I would say that as far as our testing events, we do those frequently. Someone could literally call us and say, look, I want you to pop up a tent and test tomorrow. Here's the location. Great, we'll do it. We have a testing tent to protect the individual's privacy. And then they can also just call us and be like, hey, can I come in to Uptown Family Practice or another location and just be tested real quick on my lunch break or after work or whatever it is. And we'll do it right then and there in the office.
Awesome.
Alex and Catherine are normally the ones that are there doing that.
That's wonderful. Go ahead.
Sorry, I'm not sure if you mentioned, but it's only a finger prick.
Yeah.
We don't have to take any blood work out.
Yeah.
Right.
Yep.
And that's just, so
Because some people are scared of that they're going to get, a whole bunch of blood work taken out.
Sure.
And it's just, we stick your finger and that's it.
And the finger prick is just Hep C, right?
Yes.
And then the saliva swab is
for
HIV.
Yes.
Yep.
So like it couldn't be easier, right? Like you have to get more stuff drawn out of your body on like a regular physical.
It's
right?
free. I don't know if we mentioned it.
And it's
free.
free. It is free testing. You don't have to wait for an event. We have plenty of those, but if you can't make it to those, you can literally just call and say, hey, I want to know.
Yep.
And you don't have to be a patient either.
Right.
So anyone at
Awesome.
all can get
Anybody.
tested.
I love that. And then if you do, once you come see us, if you love the services provided and you do need a primary care provider, we would love to be that for you. But you do not have to be. We just want everybody to know. We want people to get tested. That's awesome. That's awesome.
Yeah. We love what we do.
Yeah. Yeah. And y'all are great at it. Y'all are
you.
absolutely
Thank
wonderful at it. Y'all have got great stuff going on. And it's really neat that it's another thing that we are able to, as a corporation, I say corporation, that sounds cold, right? Doesn't
As an
it?
organization.
As an organization,
Yeah.
as a nonprofit, as your healthcare provider, it's another level of care that we're able to offer, whether patient or not, to the community.
Yeah.
And so that's fantastic. So we're just out here trying to keep the Lakelands, try to keep everybody healthy.
Yep.
All right.
Yeah.
Awesome. Well,
Thank
thank
you.
y'all so much for
you.
sticking with
Thank
me.
you.
Thank you.